So my name is Dr. Crystal Narcisse. I specialize in internal medicine and pediatrics at Norton Healthcare. I've lived in Louisville for 15 years. In 2020, of course, with the pandemic, a lot of people were getting sick. There was a lot of social isolation. There was a lot of death. Tens of thousands of people. Because the hospital was full with patients with COVID, other patients were having delayed treatment, not because we didn't want to help them, but because it exceeded our capacity. There was one story I thought about where a patient of mine, her son was diagnosed with cancer and he was dying and she could not go see him in the hospital. So imagine being a mother not being able to say goodbye to your child. It was very scary and it was very unsettling. I never, ever want to go back there. The tides really turned when the COVID vaccine came out. The number of people having to go to the ER, the number of people actually having to be admitted to the hospital or going to the ICU, or even the number of people at our hospital system that got sick, you saw those numbers plummet. What a difference between now and 2020. I was worried about the COVID vaccine at first, I'll just be honest with you. But I said to myself, I love what I do. I love being able to provide health care to people. And if I can take a vaccine that'll help me to be able to keep doing my job to help people, I'm willing to do that. And thankfully, I haven't had COVID since I've had the vaccine. Most of my patients who've gotten the COVID vaccine, when they actually get COVID, they have a sniffle, sneeze, they may feel a little ill, but they're not having to go to the emergency room because of it. So they see that there's definitely a benefit for getting the vaccine. It's always good to prepare for the worst and expect the least. Prior to working at Norton Healthcare, I worked at a place called Park Duval Community Health Center. It serves the most medically disadvantaged part of the city. Working at that particular place taught me a lot about the humanity of medicine. It is very important that as a patient that you find someone that's going to see you for who you are, that they listen to you, that they're not rushing, and they come up with a treatment plan that's catered just for you as an individual. I'm not going to tell you to do something I'm not going to do. I want you to be able to know that I have your best interests at heart. I want you to know that I care about you. It's important that you find someone that makes you feel like a person, that you're not a number. I was raised to know and believe that we are not an island. We have a community. What I learned from my dad was that we have to do good despite what happens to us. If we do that, we can not just only change our family, but we can change everyone around us. I don't take being a doctor lightly. If I make sure that you're healthy, then I'm helping not just you, but generations after you to have a brighter future, to be a better person, and to just live more positively.